Thank you for joining us. I'm Yomi Otaigbe. It's health news, and today we'll be looking into malaria control efforts in Nigeria and how dwindling global funds could affect the control program. Malaria control in endemic countries has made huge strides forward, but progress is stuttering as funding starts to level off. For instance, according to the 2013 World Malaria Report, in sub-Saharan Africa, 150 million insecticide-treated nets are needed annually to achieve universal coverage. Number delivered to countries in this region was 66 million in 2012, down from 145 million in 2010. In the course of the program, I'll be speaking with the Director General of the Nigerian Institute for Medical Research, Professor Innocent Uja. Before we go into malaria control issues, let's delve into news on the local and international health arena. Issues surrounding the chaotic drug distribution network in Nigeria seem to be getting some attention as the United States government has agreed to support Nigeria in financing the construction of a pharmaceutical warehouse in Abuja, the nation's capital. The supervising Minister of Health, Dr. Khaliru Al-Hassan, who announced the assistance, said the project, when completed, will reduce wastages and improve supplies of medical consumables to government hospitals across the nation. The project, which is codenamed Warehouse in a Box, is expected to be completed within 5 months.
The significance of this is that we will be able to have all our drugs in one roof, under one roof. Presently, our drugs are scattered all over the country and in different state of, safety. Sometimes we are not even given proper track of how good these drugs are. The condition where they are stored are beyond the standard expectation. So with this edifice now on ground, this will ensure that Nigeria will be saving a lot of money, ensuring that the drugs are well stored and they are in one place, so that we'll, at fingertip, will know the state of our drugs. So it's a very important venture.
From now on, now that all the administrative work has been done by the government of Nigeria, we will take full responsibility for the physical construction. This is a semi-prefabricated structure, so once we get the foundation laid, this building will be up very, very quickly.
And as you watch this, the medical guild, that is doctors working for the Lagos state government, have made good their threat of embarking on a 3-day warning strike, which began on Wednesday, 18th of February 2015. The medical guild wants the government to address issues such as what it describes as the continued engagement of doctors as casual workers, the suspension of the training of resident doctors in the Lagos State University Teaching Hospital, LASUTH, and the administration's no work, no pay policy to members of the guild. Although the Lagos State Governor, Mr. Babatunde Fashola, appealed to the health workers not to embark on strike, this did not change the resolve of the doctors. Governor Fashola, while speaking at the 2015 State Council on Health, said health workers must reach a consensus never to go on strike again, adding that they have the onerous responsibility to save lives.
Whatever the provocation, whatever the disagreement, doctors and nurses in Lagos must reach a consensus, never again to go on strike. You see, I ask this not for myself. I ask it for the public that you serve. I have said repeatedly, and I will say it again, you are like God on earth. God does not go on. And I believe that when all is said and done, we cannot live a life without conflict and differences.
Over now to another part of Africa, precisely Liberia, where thousands of Liberian children in uniforms flocked back to school after a 6-month hiatus designed to stem the spread of an Ebola outbreak. Pupils welcomed the move, but some raised fears that the deadly disease had not yet totally eradicated. Staff at school gates were equipped with their thermometers to take pupils' temperatures and buckets of chlorinated water for them to wash their hands. Students gathered in school courtyards where their teachers showed them how to protect themselves against Ebola by keeping their distance from other students. Liberia was one of the 3 West African countries worst affected by the Ebola outbreak identified in March 2013. More than 9,000 people have been killed by the virus, but there has been a general decline in the number of cases in recent weeks. Outside Africa, a major European obesity investigation has called for urgent action to prevent obesity in women of childbearing age. The authors, including a team from Edinburgh University, say children born to overweight mothers are at greater risk of health problems in later life. In one of the most extensive studies to question whether the health of mothers-to-be can have long-term consequences on their offsprings, scientists pulled together several pieces of research across Europe. One key study involving 13,000 individuals revealed that babies born to overweight mothers are more likely to suffer heart disease or strokes or develop type 2 diabetes in later life. Another analysis found that obese women eat a diet richer in saturated fats and poorer in vitamins and minerals during their pregnancy compared to slim women. In early work, including animal studies, scientists found that the placenta of females who ate a high-fat diet offered less protection to the fetus from the stress hormone cortisol. Offspring were more likely to be small and to suffer mood disorders in later life. The researchers say every pregnant woman should have access to dietitians and psychologists to help protect the health of their future children. That's a wrap from our news corner. I'll be back with my conversation with the Director General of the Nigerian Institute for Medical Research, Lagos, Professor Innocent Uja, and we'll be looking into malaria control efforts in Nigeria.
It's about your world, about the extreme weather conditions and their effects on your existence, about the unusual rainfall, the heat, harmattan, flood, desertification, and drought. The climate talks and politics where government policies hit the mark and when they got it all wrong. Really, it's about you and your environment. New episode of Earthfire at this time, only on Channels Television.
Thank you so much for speaking with us on Health News.
Thank you very much.
We're looking at malaria control. What would you say is the situation in Nigeria?
Well, let me just say that malaria is an endemic disease, in Nigeria and most developing countries of the world, particularly tropical part of the world. Malaria has been with us for years, and perhaps I must say it might still continue to be with us for some time. But there are strategic efforts to ensure that we reduce the burden of the disease. From the health point of view and even from the economic point of view, malaria is one of the commonest diseases that affect us. And apart from the fact that it is one of the commonest causes of illness among children, it is also the commonest cases of outpatient treatment in Nigeria. As you know, it is caused by Plasmodium falciparum, transmitted by mosquito. And we believe that a lot has been done. A lot is being done.
So what would you say are those things that have been done?
Well, what will I say have been done? First of all, the federal government, state governments have put programs in place. We take this, one is to the control, because at the moment we are in the era of malaria elimination, i.e. Nigeria, how do we bring down the burden of malaria? And one of the things that have been done is looking at the environment, because the environment is very important. Environmental management, personal hygiene, environmental hygiene is very, very important. A situation where you find that there are lots of stagnant water where mosquito breeds and therefore generate malaria, falciparum, where it grows. You find that in areas where there are stagnated water, that is where mosquito grows. And this is the one that transmits the malaria, Plasmodium falciparum. And therefore, there is strategic action in terms of malaria control to larvicide these areas, in addition to sensitizing the public to have environmental cleanliness. As you know, environmental cleanliness is one of the ways of reducing the burden of the disease. In addition, you also know that between 2003 to now, Nigeria also has been part of the program of preventing mosquito bites through insecticide-treated nets, which is being in place and is being used by many, many people, particularly pregnant women and children. We also have what we call intermittent preventive treatment of malaria in pregnancy, i.e. you give sulfadoxine pyrimethamine in pregnancy to prevent malaria infection in pregnancy and also for prenatal transmission. And that is a very important component of malaria control. Apart from indoor residual spraying, which you have to spray the rooms to be able to ensure that mosquitoes are killed and therefore they are no longer alive to transmit the disease.
Let's talk about funding. You know that in recent years there have been dwindling funds when it comes to support for not just malaria but other disease conditions. How do you think Nigeria can weather this storm and own the response? You know that some of these insecticide-treated nets and malaria drugs are supported by the donors.
Generally, there is dwindling fund, even for development partners. And Nigeria is also suffering the same. As you can see, the price of oil is going down. But one of the first things that we need to think about is the ownership of this program, such that even when donors leave, we can continue to sustain the program. And I think that is what the federal government of Nigeria is doing at the moment. We no longer depend wholly on donors. We think that, and the National Health Act clearly provides for some of these. I mean, previously we never had any regulation, any law guiding the practice of regulating the practice of health. But National Health Act, if and when it is properly implemented, you find that many of these things can be obtained. But health is very expensive. And we believe that the National Health Insurance Scheme should be the fulcrum. And we're talking about universal health coverage. So if we're able to subscribe and buy into the National Health Insurance Scheme, which is the practice in Europe and America, I believe that many of our problems will reduce. It will not be solved completely, but it will reduce. So we keep on strategizing and re-strategizing, monitoring the burden, and also plan how we can overcome some of the challenges. We need to ensure that all the managements are holistic, environmental sanitation. We need to have